The following program is sponsored by the Medicine Center Pharmacies. You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us this morning. Before we begin, I would like to thank our sponsors, Western Medical Center, Studio Arts and Glass, and of course our socially distant technical producer, JD DeAngelis. We continue our shows from our administrative offices and wish our friends at WHBC and our listening audience continued good health. In the studio with me is Brad White, the compounding pharmacist.
Well, when most people think of a pharmacist, they think of a friendly professional in a lab coat behind a tall pharmacy counter, counting pills and putting them in a bottle. Well, at the Medicine Center Pharmacy, a job of the pharmacist isn't just about filling prescriptions. It's about helping people live healthier lives. Pharmacists coordinate all of your medication needs, from a doctor to a nurse practitioner to a variety of different people on a healthcare team. And best of all, we're available to talk to you at any time you need to consult and help you find solutions for problems that you have that you're trying to solve that maybe you were frustrated with. So you can do all that with no appointment necessary. Today we're going to talk about all of the services we have at the Medicine Center Pharmacy. Some you may know about, some you may not, but we're hoping to help keep you healthy and happy during this pandemic and every day. We'd like to remind you that we do have this program available as a podcast. You can download it from your favorite podcast app. Just look for Health Matters with the Medicine Center Pharmacy, and you can subscribe to our podcast.
So every week we ask our guests to tell a little bit about themselves, but neither Brad nor I have taken the opportunity to share a little bit about our backgrounds and our roles at the pharmacy. So Brad, you get to go first and share a little bit about yourself.
All right. Well, let's see. I started working with the medicine shop pharmacies back when I was in high school, and I started at the bottom level. So I was sweeping parking lots and cleaning up, and then became a pharmacy technician, and then went to college at Purdue University after graduating from Glen Oak here in North Canton. Had some training in Indiana at Wishard and IU Med Center before coming back to Ohio to join the family company and ultimately be a pharmacist for over 20 years in our new Philadelphia location. It's been a really rewarding experience to get to know thousands of patients and to be able to help them solve problems that sometimes are unique to everyone's particular situation. It's not uncommon for a patient to come into the pharmacy desperate for a solution on a 4 or 5 o'clock hour after all the providers have gone home for the day. And we get to help them find a solution for a problem that sometimes has limited options. So it's challenging and exciting, and I hope that, at least in my career, I've been able to help some people with some problems that nobody else was able to help them with.
So at the Medicine Center, we like to say we just don't know your medicine, we know you. Can you explain how important the pharmacist is in the healthcare team?
I kind of feel at times the pharmacist is someone who kind of pulls everything together, because we have a tendency to be at the center of the patient experience. Interestingly enough, we can be the really good guy when we help them find a prescription that is a better value for their copay or their expense. We can be the bad guy when the insurance company will not fill their prescription because it's not on their formulary. But hopefully we can be the problem solver when a patient has multiple medical conditions and they are meeting up with several providers, whether it be a cardiologist for their heart or a rheumatologist for some pain or a pain management doctor. Oftentimes patients just don't see one practitioner anymore. And trying to help everyone coordinate together is sometimes a challenge, and it's helpful for us to be able to see the whole picture. So one of my best advice takeaways for our listeners today is it is really best if you can use one pharmacy. And at the Medicine Center, when you come to us, we can see all your prescriptions from all your providers, and it helps us make sure you don't have any drug interactions. It helps us make sure that there aren't any incompatibilities. And it also helps us communicate more effectively with all your practitioners when they have questions for us about other therapies you might be on that unfortunately they haven't had experience with because another specialist has ordered it for you.
So, Brad, we feel our stores exceed the CDC and health department guidelines to offer a safe environment for our patients and customers, particularly in this time with a virus rampaging the country. Can you explain what we're doing for both customers, staff members, and make things safe for them during this pandemic?
Well, I think we've done a number of things. We have done our best to keep up with the CDC guidelines and the State Board of Health and the governor's wishes and our local health departments. And sometimes things are a little bit more restrictive depending on where you are in the state. We have a lot of new procedures in place with respect to how we monitor the severity of a particular county's infection rates. Happily, in Stark County, we stepped down to the lower level yesterday, so I'm excited that everybody's working together to help make that happen. In the pharmacy, I want you to know that you should have complete confidence in your ability to use our locations in any capacity that you're comfortable with. So, for example, we have walk-in service available. You can come in the pharmacy. We have acrylic barriers up to protect you from our staff and our staff from you. As you know, as of 6 p.m. last night, and even before this, all of our staff members have been wearing masks in the pharmacy to keep safe from each other and to keep you safe. So that's in the pharmacy. Not a problem. Maybe you're more prone to want to use a drive-up window. Not a problem. We have drive-up windows in every location. So you can drive up to the window. We can service you there. If you have a more complex need that you need, we can serve you curbside. So you can pull up to the curb. We have signs out front with a text or a voice phone number, and you can message the pharmacy, and we can come out and, if you have an extra service that maybe won't fit through the drive-up window, like maybe it's a case of diapers or a larger box, like a nebulizer box or something, we can help you get that without having to worry about stuffing it through a small drive-up window. But we have a number of different ways. We even have home delivery, and we have had home delivery for probably 35 years or better. There's been a lot of smoke and mirrors about other pharmacy locations in the community delivering, but really most of those locations are by mail. They're going to ship it overnight or in 2-day service. It's going to sit in your mailbox in this 90-degree heat and cook. So if you want true personalized door-to-door service, we can deliver to your home. If you're more comfortable with non-contact delivery, hey, it's no problem. We can talk with our delivery drivers, and we can make it so we can leave it on your doorstep and from a distance observe you pick up your order. So whatever you're comfortable with, we can help you with it.
So, Brad, COVID-19 is on everybody's mind on a daily 24-hour basis. Talk to our listeners about the products we carry to help them through this pandemic and your recommendations to keep the immune system strong and healthy.
I think nutrition is really a key because whether it's a flu season, a cough and cold season, or now this COVID pandemic, your first defense is your immune system. So you got to keep your immune system healthy. And there's a number of different things that you can do to do that and help support it. So first of all, I would recommend you do your best to get at least 7 hours of sleep a night. If you could get yourself a good night's rest, a lot of biochemical reactions in your body can happen to help make you at your best and support your immune system. Stress levels, when they're high, that puts pressure on your immune system, and over time, pressure on your adrenal glands, and it makes it more difficult for you to respond to infections as simple as a common cold or something like COVID-19. As far as true nutritional recommendations, I have several. Simple basics, a good multivitamin. We have Linus Pauling Super Multivitamins, which has been our most popular vitamin that we've had for years. It's kind of like a Centrum with extra herbal energizers and antioxidants. So you get more value for your dollar, and it's a great product for just a basic multivitamin. Vitamin D. You cannot go wrong in the Midwest taking vitamin D. There are a number of different recommendations based on your particular condition, your age, your disease states you may have. Generally, for listeners' benefits, I personally take 4,000 units of vitamin D a day. It's something that you can add to your diet. We don't get a lot of sun outside, even though we've had a pretty nice summer weather-wise. But over the course of all the seasons, if you're not getting enough sunlight, you're not making a lot of vitamin D in your body. So vitamin D is a big number 2. As far as other supplements you can use, there's a number of different things. If you want to really drill down, I'm going to touch on 2 more just for benefit. One of the things that I've really liked is a supplement that I found at a natural product show about 1.5 years or 2 ago. It's called Immunopower, and it's from Switzerland, if you can believe it. But it's a beta-glucan product, and beta-glucan has been shown to help boost your immune system and help your immune-fighting cells have a little bit more punch when it comes to identifying foreign invaders. So I'm happy to say that I've been taking this for about 1.5 years, and the vitamin D and a good multivitamin, and I have been very happy not to have any colds or flus or illnesses or COVIDs. So I can't promise you'll have the same benefit, but for the basics, for good support for your nutrition, I don't think you can go wrong with a good multivitamin, vitamin D, and something like an Immunopower, which is available on our website at medshoprx.com, or you can also come into the pharmacies, and we're happy to help you with it.
So how about this? From PillPack Exact Care Pharmacy, I've seen commercials featuring pill packets to make medication organization easy. And, of course, we're proud to share that our pharmacies offer this same service for free, no extra charge. Can you explain how it works and demonstrate the product for listeners?
I can. We have, there's a lot of marketing around this, and I think in the past 12 to 18 months, especially in our pharmacies, we've had a lot of people reach out that have been challenged, frustrated, and trying to find an easier way to manage multiple medications. This could be a person that is an executive that does a lot of traveling. It could be a long-haul truck driver who doesn't want to take 10 bottles with them. It could be a patient that's just living at home by themselves and takes 4 or 5 or 6 medications a day and is trying to make sure they find a way to keep them all straight. Well, our Easy Dose Packs are something that we're really proud of. It is something that we can do to put you together at our pharmacy with a pharmacist or a health coach. We can have them call you a week or so before your meds come due. We can help make sure that you have all the refills necessary you need on file. And then we can package them into individual dose packages. And these individual dose packages are dated by the day and time. So if you take a medication, breakfast, lunch, and dinner, you will have 3 packets for the day. You'd have breakfast, lunch, and dinner. And then all your medications would be lined up in those packets. And on each packet, we put the name of the medication and the time of day it's to be taken. And it's something that, maybe you work at a school or an office building. You can just tear off your day's dose. You can stick it in your purse or your lunch bag, take it with you, and you don't have to worry about taking all your other bags with you or your bottles with you. So this is something that is very simple. It is highly customizable. We can work with all your providers. You don't need to go to mail order. You don't need to go to Amazon, and you certainly don't need to use some pharmacy that's going to mail it to you and sit it on your front porch or in your mailbox and hope that you remember to get the box because they didn't give you their delivery confirmation. This is something that's really simple. It's available here locally, and we appreciate your support as a local business, and we're happy to be your pharmacist to do so.
Okay, Brad, we have to take a break here now. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshoprx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, Paul White from the Medicine Center Pharmacy. From 1976 to the new year, 2020, we've been part of the Canton community. This year, we celebrate 44 years of service. Thank you for your business and continued support of the Medicine Center Pharmacies. A lot has changed in the pharmacy world over the past 44 years, but one thing hasn't: our commitment to your health. Stop by your local Medicine Center Pharmacy in Canton, Louisville, Minerva, or New Philadelphia, where wellness begins.
Mercy Medical Center wants you to know we are here for you literally and virtually. For our patient safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for stat care, urgent care, 7 days a week, and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be used by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So, whether you are in need of urgent care for minor illnesses and injuries or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Mercy Medical Center telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance copays and deductibles apply.
Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia. Hi, Paul White from the Medicine Center Pharmacy. In these difficult times, please stay calm and make sure your medical and healthcare supplies are well stocked. Have Kleenex, pain relievers, fever reducers such as Tylenol, and cough syrup like Robitussin, Dayquil, cough drops, and maybe a humidifier. And make sure you take a good multivitamin like Linus Pauling Super Multivitamins. Also, you might get a good probiotic, and make sure that you get plenty of rest and plenty of nutritious food. The Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are discussing pharmacy safety features during the COVID-19 pandemic. So, we talked about the pill packaging service, Easy Dose Pack, and how much does it cost?
Well, you know what? That's one of the great things. This service is a free service that we offer at the Medicine Center, so it doesn't cost you anything additional other than your prescription copays you would normally pay. And the really nice thing is it actually might pay you in a way that you may not be expecting, because when we have to package all these medications for you in nice packages like this, it means generally you only need one delivery or one pickup stop at the pharmacy each month. So it might save you some time. So not only is it a free service for special packaging, it can save you some time because you don't need to come to the pharmacy 2 and 3 times a month.
You know, we started, as you mentioned earlier, the show delivery service many years ago. And we now have practically a fleet of delivery vehicles that are handling all of our stores and moving merchandise between our stores to make sure everybody's well stocked. So during this pandemic, it's an excellent way to reduce your exposure. So tell our listeners how this program works.
All right. Well, our delivery service is free. It's one that we are continually striving to be more efficient on so that we can serve more patients on a daily basis. And what we really like to do is we like to assign you to one of our health coaches or our pharmacists, and to be proactive about your health care. We can't help you if we can't work together with you and your provider. So if you run out of your medication and you don't have a refill, well, that makes it hard for us to fill your prescription, and it makes you have a point where, we don't want your blood pressure going up because you're out of prescriptions. So we try to have all your orders ready in advance, and we try to schedule it on a day that's best for you. So what we'll do is we'll try to have a situation where we can schedule to you in a certain time window on a given day, and we know in advance. We make arrangements for emergency deliveries on a daily basis for antibiotics or things like that, where things come up that you just can't plan for. But we really like to have you on our health coach program, which is our term for a medication synchronization program. It helps us schedule you a regularly scheduled delivery each month on the same day. And then that way, you know when to expect us and you know when your medications are coming due. So if something changes, we can work together to find a solution. So generally, if you call us today by noon, we'll get it out to you the same day. Sometimes what we'll do is we'll call you Monday and you'll say Thursday's better, and we can plan for it in advance, and that helps us makes us more efficient, and we can serve a lot more patients that way. So we've actually been expanding our delivery areas. So now we deliver from Alliance to Canton to North Canton, and our new Philadelphia market. We deliver in Denison and Yorksville a couple days a week, Louisville and East Canton and Minerva. We can go up to Massillon. So it's just a matter of planning. We can help you. So don't be afraid to call and ask if you would really like to take advantage of home delivery. It's something that we can help you with. We just have to schedule it, and we'll make it happen.
So I know everyone's concerned with prescription costs, particularly what they take. And many of you may be familiar with Martin Sheen's commercials for Single Care or GoodRx commercials, where mom is struggling to cover the cost of her son's prescriptions. So let's talk a little bit about discount cards, how they work, and how our pharmacies provide the lowest possible price for our customers.
All right, well, let's talk about GoodRx and Single Care. And while I want to jump up and down and tell you that Martin Sheen is not going to help you buy cheaper prescriptions, what I really think is very important for our listeners to know is that with every prescription program that you see on TV like that, GoodRx, Single Care, Secure Care, some of these other cards, if you open a magazine and you see a card in there that says get 98% off your generics, no monthly fee, let me tell you what the monthly fee is on that, okay? The fees on GoodRx and Single Care and whatever generic card you find in a magazine are kind of hidden, and they're hidden from you in ways because they have to pay for their marketing. They have to pay for all their network fees. The scary thing is that they take all of your personal information and they sell it to everyone who will buy it. So if you use a GoodRx or a Single Care card, you can be guaranteed your name, address, phone number, date of birth, all your demographics are being sold. So if you're comfortable with that, great. But keep in mind, your privacy is a very important thing you need to protect. So we're going to talk more about how to get you value pricing because it's time for our commercial break for the end of the news break. But please join us after the news for the rest of this conversation.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's MEDSHOPRX.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment. Mercy Medical Center wants you to know we are here for you literally and virtually. For our patient safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for stat care, urgent care, 7 days a week, and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be used by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So, whether you are in need of urgent care for minor illnesses and injuries or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Mercy Medical Center telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance copays and deductibles apply.
Yes, we are open. We are open. The Medicine Center pharmacies and the Half Off and Out By store in Louisville are open. Some great services are still in play. Our drive-through windows, curb service, and our enhanced delivery service. Our stores are fully inventoried and fully staffed for your convenience. 13 pharmacists to help you with your medications and over-the-counter products. So don't hesitate to visit us or use one of our services. Medicine Center Pharmacies in Canton, Louisville, New Philadelphia, and Minerva.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's studioartsandglass.com.
Hi, Paul White from the Medicine Center Pharmacy. In these difficult times, please stay calm and make sure your medical and healthcare supplies are well stocked. Have Kleenex, pain relievers, fever reducers such as Tylenol, and cough syrup like Robitussin, Dayquil, cough drops, and maybe a humidifier. And make sure you take a good multivitamin like Linus Pauling Super Multivitamins. Also, you might get a good probiotic, and make sure that you get plenty of rest and plenty of nutritious food. The Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Today, Brad and I are discussing pill pack free delivery and other pharmacy services. We've got a lot more to cover this morning, so let's get back to the show.
All right, before the break, we were talking about affordable prescription prices and value. And, we've had questions and patients that come in with cards from GoodRx or Single Care or some other free one you might have found out of a magazine. And, a lot of the things that people don't normally realize is that there's a lot of your privacy that's violated when you use those cards. So be aware that if you've ever used GoodRx or Single Care or ever think about it, they're going to sell all your information. So they're going to know who you are, where you live, your age, your medications you're taking. It's a pretty invasive process. It's nothing we can control on the pharmacy side. Your privacy and HIPAA information are completely safe with us, but those companies actually have something in their agreements that allow them to sell your medication when you sign up for them. So what can we do? You have an expensive medication and it's difficult to afford and you need health care. Well, here's what we can do. At the Medicine Center Pharmacies, we have the opportunity to have you work with our pharmacists and find solutions. One of the good things now in this day is that there are a lot of different therapeutic options across different drug categories where there are generic medications available. So I just had a situation in Louisville when I was working earlier this week where a patient came in and they had a really expensive prescription. It was generic. It was still expensive, but it turned out that it was a newer generic. It was a controlled release product that you only had to take twice a day, and it cost like $189. But if you were able to take the non-controlled release product 4 times a day, it was going to be less than $10. So there's a number of different ways we can help you look at value. Sometimes it's generic. Sometimes it's a different form of the generic that maybe isn't controlled release. Or sometimes it's in a drug family that is somewhat similar that can still give you some benefit based on your particular therapeutic condition. So really it comes down to a conversation. Don't be afraid to share that, hey, prescriptions are expensive and I'm trying to get the best value for my dollar. Is there something we can do to help make sure that my blood pressure is under control and I can still go to the grocery and buy food and pay my rent? So we do it every day. So our prescription wellness program that we have, it's called our generic wellness program. It's got a couple hundred of the most commonly prescribed medications that have been around for years. And, for sometimes less than $4 a month, you can get a 30-day supply of that medication. So we have a number of different programs available. But let's talk about it. Call our pharmacies, stop in, come to the window. We'll talk to you, and we'll help you find a solution and save some money.
I guess it's back to school time here.
Getting there.
I don't know if we're going to get back to school or not, but I guess we're going to get back to school, okay? And the kids certainly need it. And for those of you who don't take advantage of our free vitamin program, Kids Vitamin Program, the program is for children kindergarten age through the 5th grade of each year. And when you come into our store, you fill out a form like this, gather a little bit of information about you and your child, and we don't sell it. We keep it private, your information. and you get a free bottle of 30 children's chewable vitamins every month. And we give you a card, punch card, and you come in every month and pick up a bottle of children's vitamins free. And in some cases, we have 4 or 5 children that from the same family that are on the program. So this is one of our programs that we instituted several years ago. We literally have thousands of people, children on this program in all our stores. So please take advantage of it. We know in this day and age that the fast food diet and the diets of many children are just not up to snuff. And this is one way to try and help these children get a complete round of vitamins. So that's program number 1 that we're doing. And we also have another program for people with diabetes. And this program was instituted several years ago. And we give you, as a diabetic patient, we give you a free gift package, which includes a blood glucose monitor, strips, 50 strips, lancets, a lancing device, some glucose tablets. And this is, for us, has been extremely successful in making sure that people with diabetes, whether type 1, type 2, are assured that they can monitor themselves, they can monitor their diabetes. For those of you who are not familiar, it's just a little finger prick device. You need a very, very small blood sample for the strip, for the meter to read your blood glucose. It's important that you test your blood glucose at least a couple times a day, and make sure you stay within the guidelines of what your blood glucose should be. So take advantage of this program also if you haven't. And again, we have thousands of people who have taken advantage of this program. Our strips are currently selling for $7.95, I think, for 50. Or is it 8?
It's $8.32, but yeah, compared to the brand name, it's
because the brand name strips can be anywhere from $50 a box way on up. So this is a very efficient and economical way to make sure that you take care of one of the issues in your health care and not have it be extremely expensive. So please take advantage of that program too if you have diabetes. And yesterday, I just came across a special buy on one of Brad's favorite products, and called Brain Armor. And I started taking it, I suppose 3 or 4 days ago. I did ask a couple of staff members if I looked smarter, and I didn't get any just kind of looked at it. So maybe in a few more days, I'll look smarter. Okay, so Brad, some information about Brain Armor.
All right. Well, Brain Armor is an EPA and DHA supplement. Many of you may know EPA, DHA supplements as fish oil products, which fish oil products are EPA, DHA products. So interestingly enough, this particular product is not fish-based. So if you're allergic to any type of fish or shellfish, or if you've tried fish oil in the past, and you haven't liked the fact that you might have had some fishy aftertaste or some regurgitation, you will not have that from this Brain Armor product because it is algae-based. Algae, think of like the green moss that grows on the bottom of the lake algae. How do your fish get omega-3s? Your fish get omega-3s by eating the algae on the bottom of the oceans. So this is truly the source of the plant that comes from the ocean that your body can get omega-3s from. And this particular company has done a lot of research actually on both memory health and brain health. But the neat thing about omega-3 fatty acids is you get all kinds of health benefits. You get health benefits for your heart and your cholesterol and your skin texture and your fingernails and your hair. So omega-3s are a building block that our bodies cannot manufacture. You have to get it in your diet. So if you're not eating a lot of wild-caught salmon and fatty fishes, sometimes you can get some from flax or some other seeds. look into a product like Brain Armor. I've been taking this for over a year religiously. I will tell you, I've always been a fish oil capsule person. Brain Armor comes in capsules and it comes in oil. It's a lime mango flavor. I love the oil. I have never been a person to like the texture of drinking an oil, if you will, but 10 milliliters or 2 teaspoons a day. You can keep it in the fridge. It tastes good. Have it with my coffee in the morning. I challenge you to try it because, frankly, if you feel like you've got any brain fog or you're not happy with dry skin, I really would like to think you could have some benefit. So it's something that I enjoy quite a bit.
We have made a special buy on this product also, which allows us to market the liquid only at a very special price. And 50% off, I think, may even be better than that, the regular selling price. Good chance to try it. Price is right, and I think you'll be satisfied with the product. So give it a shot. I'm proud to say that Brad's a compounding pharmacist. And tell us what a compounding pharmacist does, Brad, and what your section of the company is compounding, and how many people you've helped, I guess.
Well, compounding is something that a lot of people don't understand. So let's talk about that first. So if you think about baking a cake or making brownies, you're kind of like compounding food in the kitchen, okay? That may be a simplistic analogy, but basically what we do is we take raw ingredients, powders, liquids, creams, and we can combine them into dosage forms that a specific patient needs to meet their need based on their prescription from their doctor. So, for example, maybe you have an allergy to lactose or red dye number 5, but you need a prescription that only comes in a capsule that has lactose and is colored with red dye number 5. We can actually make you a capsule of that particular prescription with approval from your doctor without the lactose and without the red dye, and you can still get the benefit of the prescription therapy, but you don't have all the potential side effects that go along with it. So if you have food allergies, drug allergies, maybe it's a situation where you have difficulty swallowing and the medication you need only comes into a capsule. We can make it possibly into a suspension so you can take it in a liquid. It's possible we could make it into a topical form where it could be applied to the skin and you could get some benefit. So basically, I like to think of a compounding pharmacy and a compounding pharmacist as a problem solver. And what we like to do is work with the provider, and the provider wants to use this particular drug to treat the patient, but they need help getting that medication therapy into the patient because of a challenge. And it could be any number of different things. And we like to help make custom formulations and delivery doses to help deliver that medication to patients. So it's a fun and challenging way to help patients. And, we have patients that are, they come from Akron Children's. Maybe it was a little child that was born premature and has a heart condition or a seizure condition. We help your man's best friend, your dog or your cat. We've had snakes and chickens and gerbils, all kinds of different pets, and humans. It could be hormone replacement therapy for men or women. It could be something like a low-dose naltrexone therapy for a patient suffering from fibromyalgia. The opportunities are really endless, and it's something that we can work with your provider if you're having a challenge with some type of delivery form or food allergy.
Okay, gang, our final break is here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Yes, we are open. We are open. The Medicine Center pharmacies and the Half Off and Out By store in Louisville are open. Some great services are still in play: our drive-through windows, curb service, and our enhanced delivery service. Our stores are fully inventoried and fully staffed for your convenience. 13 pharmacists to help you with your medications and over-the-counter products. So don't hesitate to visit us or use one of our services. Medicine Center Pharmacies in Canton, Louisville, New Philadelphia, and Minerva. Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia. Hi, Paul White from the Medicine Center Pharmacy. In these difficult days, please stay calm and make sure your medical and healthcare supplies are well stocked. Make sure you have Kleenex, acetaminophen or Tylenol, ibuprofen or Advil, Mucinex, Robitussin or Dayquil, cough drops, maybe even a humidifier or a vaporizer. You can also just turn the shower on hot and sit in the bathroom breathing in the steam. How about vitamin D and a probiotic? And a good multivitamin like Linus Pauling Super Multivitamins that you'll find only in the Medicine Center pharmacies. So take care of yourselves and don't stress about the coronavirus. Make sure you get plenty of rest and plenty of healthy food. The Medicine Center Pharmacy, Canton, Louisville, Minerva, and New Philadelphia.
Are you tired of spending time sorting your medication? Hi, Pharmacist Paul White for the Medicine Center Pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Okay, we are back to our final segment of today's show. And so what about low-dose naltrexone? Can you tell the listeners a little bit of LBN, Brad?
Yeah, low-dose naltrexone is actually a really exciting opportunity for patients who have tried a number of different medications and not been able to get control of their particular condition. For example, we talk to a lot of patients at the pharmacy that have a condition like fibromyalgia. And fibromyalgia is a condition that can be very debilitating for a patient and really affect their activities of daily living and their ability to go to the grocery and even to hold their job or to get good quality sleep. You know, you've got a lot of muscle pain and aches and weakness and fatigue. And you know, low-dose naltrexone is something that was discovered by a doctor decades ago. And it was really one of those things that was just an accident. You know, it wasn't a medication that was developed for the purpose that it's being used for now. It was actually developed a long time ago for drug addiction and alcoholism, believe it or not, in a really high dose. But what we call low-dose naltrexone is a dose that is like 1% of the commercially available medication that's on the marketplace now. And we're able to compound a custom dose. And one of the keys to helping patients with their condition is finding the right dose. Right now, we make 23 different dosage strengths, and we have about 16 different protocols for conditions like fibromyalgia, Crohn's disease, multiple sclerosis, psoriasis. There's some information that we've got for Lyme disease and lupus, also for autism spectrum and things of that nature. So long story short, low-dose naltrexone can be used for a couple reasons. It can be used to help modulate the immune system. It can be used to boost the endorphin levels, and endorphins are that quality that helps give you that boost of energy or that feel-good reaction. And it also helps, it can really help with pain. And the neat thing about pain therapy is it's not a narcotic. It's not going to make you drowsy. It's not going to make you feel a drug screen. So it can be used safely to help you treat neuropathies or chronic lower back pain. I have to say that one of the most interesting uses that we've had patients lately is we've had some patients that have lost a significant amount of weight with low-dose naltrexone. So it can be combined with another medication and help enhance weight loss. So it sounds kind of too good to be true. We have some resources on our website, which I invite you to take a look at. We've got some videos of programs we've done in the past that provide some education. We're going to have some webinars early next month that we're going to do to provide some more education to patients and providers. And, you're always welcome to call us at the pharmacy, and we're happy to discuss more information for you. But if you have pain on a daily basis, if you have fibromyalgia or chronic fatigue or rheumatism or arthritis, if you've tried everything and you've been on everything from Humira to high doses of prednisone, it really might be something that you should talk to the pharmacy and your provider about. We have volumes of education, hundreds and hundreds of research articles to support the use. So it's very evidence-based.
How does it work?
Yes, it works, but it's dose dependent.
How does it work?
How does it work? It works one of three ways. It blocks the opioid receptors in the body, which means that it can help boost endorphins or that feel-good hormone. So if you want a comparison to endorphins, sometimes people feel that after you get done exercising and you have that burst of energy or that really feel-good feeling, that's an example of how endorphins can help enhance your body. And when you have higher endorphin levels, you have better immune system function. One of the reasons that this doctor that started experimenting with lower doses found the benefits was he was using it in patients that had HIV. And they all had really, really low HIV, or they all had really low endorphin levels and low energy levels. And when he used this medication in them, they were living much longer, and it was boosting their endorphin levels and their immune-boosting systems. And it was really helping them modulate their immune system and find ways to help keep them feeling better and more comfortable for a longer period of time. So it's very unique in how it works. Inflammation-based is one way, boosting endorphins is another, and immune system modulation is another.
What I'm curious about is why haven't we heard about this before?
That is an excellent question. And one of the reasons we haven't heard about it is because this drug has been on the market for decades. There is no patent left in the marketplace. Drug companies can't put a fancy colored sticker on it and send marketing reps out and charge hundreds of dollars for each prescription because it's off patent. So there's no army of drug reps out there marketing this. There's no fancy brand name commercials on TV. And as a result, it's kind of something that your provider or your pharmacist learns about in a research journal or from word of mouth from other patients that have had success with it. So you're not going to see your marketing ads on TV about it because they can't patent it and sell it for a higher price to make money off it. It's very affordable.
What about side effects?
There are some chances for side effects. Usually it's in the first week to 10 days. Believe it or not, one of the worst side effects could be vivid dreams. So I had a lady once who told me that she felt her cat was talking to her when she was sitting at the foot of her bed. But other than some vivid dreams after you get through the first week, generally side effects are very minimal, and usually only about 10 or 12% of the patients in our experience stop the therapy because of a side effect, and that's a really good statistic.
Very interesting. Okay, do you have to have a prescription for this?
You do have to have a prescription for it, so we can work with your provider and help provide them education and provide you education.
So I know you were having seminars here pre-COVID here. So what are we doing to get the word out?
Well, we've been enhancing our website information, and we're going to have some online webinars through Zoom and Facebook so that patients can interact, and even providers can schedule appointments to learn more about it. So we're excited to be able to offer those, and that's going to be coming up here in the next couple weeks.
Feels like we're out of time.
We are out of time.
I guess we talked right through the time. Okay, thanks for listening today. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Mercy Medical Center, Studio Arts and Glass, And, of course, our technical producer, J.D. DeAngelis. As always, we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week. We'll see you again right here next Friday on News Talk 1480 WHB.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy.